So hi again. So hoping that you are doing well in our previous topic, no? So this video is a continuation of our topic on physical examination of the integumentary system. Okay. Before proceeding to our topic, let me present this slide to you. Okay, so again, this is the second part of our physical examination on integumentary system. The learning objectives. Okay, so moving on to the secondary skin lesions that are seen in overtreatment, excess scratching, or in infection. Okay, we have the scale. So as you can see in this picture, this is what we call the ichthyosis vulgaris. Okay, a scales refers to flakes of the dead exfoliated epidermis. The color may be white, gray, or silvery. The texture may be fine or thick. Yan. So another example is the dry skin in this picture. Alright, so another example again is the crust. Okay, it is the dried residue of the skin exudates such as the serum, pus, or blood. Can be red, brown, can be orange or yellow. Okay, example, it can be seen in the impetigo. Okay, and another example is lichenification. Ayan, it is a visible and palpable thickening of the epidermis and roughing of the skin with increased visibility of normal skin. Okay, so this is due to chronic rubbing. Yan. So this condition is called neurodermatitis. Yan. So another example is the scars. Okay, so example here is the hypertrophic scar from steroid injections. You can also observe in the patient with BCG injection. So tingnan nyo yung inyong mga shoulder or could be in the buttocks. Alright? So another form of scar is keloids. Okay? So this is usually larger than the previous injury. Okay. Okay, moving on to the depressed secondary skin lesions. We have the following condition. We have erosions. This is a non-scarring wearing away of the superficial epidermis. Okay, it is moist but it does not bleed. Okay, this condition is known as the aphthous stomatitis or simply the singaw. Okay, another one is the excoriation. It is linear or punctate erosions that is caused by scratching. Example, the cat scratches. Okay, so in this picture. Another example of depressed secondary skin lesions is the fissure and ulcer. So fissure is a linear crack in the skin that is often resulting from excessive dryness or dehydration. Okay, example in this picture, this is athlete's foot. Okay, and another one is ulcer. It is a deeper loss of epidermis and dermis that may bleed or may cause scar. Okay, so this is an example. No, we will explore on this topic or on this condition in the next slides. Okay, so another example of our primary lesions or secondary lesion is the acne. Okay, kasi meron kasi mild to severe. Okay, so the acne vulgaris is a common cutaneous disorder. Okay, there is an increased production of sebum stimulated by androgens. Okay, this is common in the teenagers. And this can be found in the areas that has greatest number of sebaceous gland, namely the face, the neck, the chest, the upper back, and the upper arms. Okay, so this image is an example of ito na yung secondary lesions ng acne vulgaris. There is already a pitting scars. Ayan, nag-form na ng scars. Okay, so moving on to vascular lesions, we have what we call spider angioma. It is a fiery red, sometimes it is raised, it is numerous in telangiectatic mates, and may indicate a liver cirrhosis or liver disease. This can also be seen in pregnancy or in the patient with vitamin B deficiency. This can be found in the face, in the neck, the arms, and the upper trunk. Alright, so another one is the spider vein. Okay, this may resemble a spider or maybe linear, irregular due to increased pressure in the superficial veins, as in varicose veins. So another condition is the cherry angioma. It is a bright or ruby red that may be become brownish. Okay, it is round or can be flat. Sometimes it is raised. It increases in size and number with age. Okay, this can be found in the trunk and extremities. Ayan. So another lesions or type of lesions, the purpuric lesions. We have what we call the petechia or purpura. Petechia is a deep red or reddish purple. The size is between 1 to 2 millimeter. Okay. However, the purpura is larger than petechia. Okay. This can be due to chronic sun exposure, or it may indicate bleeding disorder, such as in dengue hemorrhagic fever. Diba? Tinitingnan natin, binabantayan natin kung may petechia. Okay, if it is petechia daw, there is an emboli to the skin, or if it is purpura, that could be a sign of vasculitis. Another condition or another purpuric lesions is the ecchymosis. This is a purple or purplish blue fading to green, yellow, and brown with time. This is larger than the petechia. It is more than 3 millimeter in size. It could be round or oval, sometimes irregular. This bruising is from trauma, and it can also be seen in the patient with bleeding disorder. Okay, so moving on to the skin tumors, we have what we call the actinic keratosis. Okay, this is a rough, scaly patch on the skin that develops from years of sun exposure. It can often be found in the face, in the lips, in the ears, in the forearms, in the scalp, in the neck, or at the back of the hands. Okay, another one is the seborrheic keratosis. Okay, this is a common non-cancerous skin growth. People tend to get more of them as we get older. Diba napapansin natin to sa mga lola at lolo natin. Usually yellowish to brown, black or light tan. Okay, so an example of benign nevi, yan. So, or mole, it is round or sometimes oval. It is sharply defined border. So, maayos ang kanyang border. It is uniform in color, especially tan or brown. The diameter is more than or greater than 6 millimeter. Okay, so moving on to another skin condition or problem of the skin, we have what we call the pressure sores or ulcers. Okay, or the cubitus ulcer. Okay, this is usually developed in the bony prominences of the body. Okay, resulting in ischemic damage to the underlying tissues. Okay. So, it is very important for the nurse to evaluate the risk of the patient to develop a pressure ulcer. Kasi sabi nga, prevention is better than cure. Yan. You have to take note of the risk factors for pressure ulcer like decreased mobility, decreased sensation, cannot feel the pain anymore, okay, cannot feel the touch, decreased blood flow from hypotension or microvascular problem such as in diabetes, fecal or renal incontinence, hindi na kayang umihi or umiihi or dumudumi na lang sa diaper. Presence of fracture. They are very high risk for developing pressure ulcer. Okay, the cause of, again, pressure ulcer is the sustained compression. Okay? So, decrease kasi yung movement. Hindi na move kasi unconscious or immobile ang client. There is a shearing forces from bodily movements. Hirap nang gumalaw or kapag minove ng nurse, hinahatak lang ganon. Okay. So again, pressure sores is easier to prevent than to heal. Okay. For the nurse to assess if the patient is or has a higher risk of developing pressure sores or ulcer, we can use the Braden scale for predicting pressure sore risk. This can be found in your book, okay, on page 184 to 185 on your Bates physical examination. Alright, so there are 4 stages of pressure ulcer. The first stage affect only the epidermis of the skin. Okay, as you can see, the skin is intact. Okay, there is a change or changes in the temperature. It could be warm or cold. There can be changes in the sensation. Okay, the patient may complain of pain. There is a changes in the color. Okay, nagiging red, okay, or pink. And the second stage or the stage 2, there is a partial thickness skin loss, okay, or ulceration that involves the epidermis and the dermis, or both, okay. Then the third stage is the full thickness skin loss. Ayan, so meron ng full thickness skin loss that involves the epidermis, the dermis, and the adipose tissue. Okay, while the stage 4, okay, there is a full thickness skin loss. Yan, full thickness skin loss to underlying muscles. So affected na yung muscle, yung bone, as well as the underlying structures or supporting structures. Yan. This image is just an example of pressure ulcers that affect the buttocks. Okay, kasi ito yung area, lalo na kapag yung patient is unconscious, ito yung palaging nakahiga. Nandito yung pressure, tapos hindi na move yung patient from side to side. Plus, yung patient, meron na siyang fecal and urine incontinence. Yan. So, pwedeng magka-develop ng ganitong ulcers. Again, the stage 1, only the skin is affected. There is already changes in the color of the skin. Okay, the stage 2, it affects now the dermis, okay, the epidermis and the dermis. And then the stage 3, so affected na yung subcutaneous, di ba? Nakikita nyo na yung yellowish dyan. And then the stage 4, these are the bony prominences, okay. This is the ankle, no? And the stage 4 is the side of the buttocks, the trochanter, okay? It involves, nakita nyo na yung muscle, the bone, or the fascia, kita na rin dyan, no? And the underlying structure of the skin. Alright, so moving on to the hair. Okay. In assessment, or in assessing the hair of the client, you have to note the quantity. Gaano ba kadami? Konti lang ba yung hair niya? Manipis? Is it thick or thin? Distribution? Is it evenly distributed? Okay, baka may mga patches dyan na walang hair. What is the texture? Is it silky? Inspect for lesions, flaking, and parasites. Of course, it's on the scalp, no? Inspect the body, the axilla, and the pubic hair. If there is changes, okay, for example, loss of hair on the legs, this can be a sign of peripheral artery disease. And if there is changes in the pubic hair or axillae, this can be a problem or hormonal problem, okay? But make sure to inquire about laser hair removal treatments. Baka mamaya ma-misdiagnose mo. Okay, kasi kaya naman pala walang ng hair yung kanyang legs or kanyang pubic or axilla dahil nagpa-laser. Alright. Okay, so this is another example of our hair problem. The hair loss. Okay. We have what we call the alopecia areata. It is an autoimmune disorder that usually results in unpredictable, patchy hair loss. As you can see in the picture, it is round or oval, no? Oval patches of hair loss. Okay, another hair problem. Okay, the trichotillomania. Okay, also called as the hair pulling disorder. It is a mental disorder that involves recurrent, irresistible urge to pull out the hair from the scalp, no matter even you stop them from doing it. Okay? Not only the hair on the scalp, okay, pwedeng pinupull din nila yung hair on the eyebrows or other area of the body. Okay. So, aside from common siya sa may problems or psychological problem or mental problem, this is also common for the children, no? Lalo na yung mga nagtatantrums, di ba? Yung parang pinupul yung hair dahil nagtatantrums. Alright? Okay, so another example of hair loss. Okay, the tinea capitis, also known as the herpes tonsurans or the ringworm of the hair. Okay, it is a cutaneous fungal infection. Okay, so moving forward to the nails after checking the hair. Okay, you have to inspect and palpate fingernails and toenails. Make sure to note the color, okay, the shape, and if there is presence of any lesions. Okay, it should be pink with white lunulae. And the cuticle should be intact or intact epidermis. It should be smooth and firm in texture. It is rounded or convex curvature in shape. Okay, so this picture shows the normal angle of the nail versus the abnormal angle of the nail. Okay, so the angle of the nail is normally 160 degrees. Okay, kapag more than na to 160 degrees, there is already a swollen or springy floating of the nail folds. Okay, this is what we call clubbing. Yeah. So, these are the findings in the nail or near the nails, the abnormal findings. We have what we call the paronychia, which is a skin infection around the fingers or fingernails or the toenails. This usually affect the skin at the base or at the cuticle, okay, or up the sides of the nail. There are two types of paronychia, the acute paronychia that comes on suddenly and it may not last long. Okay, it usually occurs on the finger, while the chronic paronychia, it lasts longer and may occur on the finger and the toes. Okay, so another example here is the clubbing of the fingers. Okay, there is a bulbous swelling of the soft tissue of the nail base, okay, with loss of the normal angle between the nail and the proximal nail fold. This is due to hypoxia or decreased supply of oxygen, or could be because of genes or genetics. This is usually seen in the patient with congenital heart disease, or there is an interstitial lung disease, or to patient who have lung cancer. So doon daw nakikita yung clubbing of the finger. Kasi nga, due to hypoxia, decreased supply of oxygen. Okay, so another findings or abnormal findings of the nails is what we call the onycholysis. The onycholysis is painless separation of the whitened opaque sa nail plate from pinker. Okay, from pinker, nagiging whitish siya. So the cause or the local cause is from trauma. Okay, due to manicuring or maybe due to psoriasis or fungal infection, or could be due to allergic reaction to a nail polish or nail cosmetics. There is also a systemic cause of onycholysis. Okay, example is diabetes or anemia. Yan. Or could be due to drug reactions, or this can also be seen to patient with hyperthyroidism, to patient with peripheral ischemia, okay, syphilis. Yan. And then another example here is the tearing nails. Okay, so the nail plate turn white with ground glass appearance. So ang pinagkaiba nitong dalawang to, sobrang white ito. Okay, ground glass appearance. Okay, so another abnormality is the leukonychia. This is a condition where the white lines or dots appear on your fingers or toenails. This is very common issue, and this is harmless now. Okay, so another example here is the knee lines. Okay, there are changes that occur in the color of the nail. Okay, there is no palpable ridges naman daw. So nakikita lang yung changes of the color. This is typically described as white band, okay, transversing the nail bed. Okay, so it runs parallel to the lunula or lunulae. Okay, we have another example of abnormal finding, the view lines that occur when the nail growth is interrupted at the nail matrix. Okay, the nail matrix, this is the place where your nail emerges from your finger. So usually the cause of view lines is injury or could be severe illness. Sometimes daw, pwede rin environmental factors. Okay. Okay, another example is the pitting. Yan, pitting nails. It's a punctate depressions of the nail plate that is caused by defective layering of the superficial nail plate by proximal nail matrix. This is associated with patients suffering with psoriasis. Okay, so after gathering or collecting the data, okay, after doing the physical examination, you have to record your findings. You can use sentences in recording your findings, or you can use phrases, okay, and carefully record your findings. So this is the recommendation for you students, no? Hindi muna yung check lang tayo. You can use sentences in describing your findings. Okay, so for health promotion and counseling, these are the important topics that you will include in your health teaching. Okay, how to prevent skin cancer, the risk factors for skin cancers, avoidance of excessive sun exposure and artificial tanning lamps, and the use of sunscreen when doing outdoor activities. Okay, these are the different types of skin cancer. The first one is the basal cell carcinoma. This appears in the basal level of the epidermis. Okay, 80% of skin cancers, that is basal cell carcinoma, rarely metastasize. Ibig sabihin, hindi siya ganun kabilis kumalat. Squamous cell carcinoma, it appears on the upper layer of the epidermis. 16% of skin cancers with squamous cell carcinoma can metastasize. And the other type of skin cancer is the melanoma. It arises from melanocytes in the epidermis. Okay. 4% of skin cancers is most lethal. Ibig sabihin, nakakamatay siya. Yan. Okay, this is the presentation of the basal cell carcinoma. This is again malignant that grows slowly and seldom metastasize. Okay, this is common in a fair-skinned adult, 40 years old older. Okay, so another example of the skin tumors or skin cancer, the squamous cell carcinoma, usually appears on the sun-exposed skin of the adults more than 60 years old. It grows more quickly than the basal cell carcinoma, and it is firmer and it looks redder. Okay, so this image is an example of malignant melanoma. This image is from the American Cancer Society. So to assess, to determine if the mole is a malignant melanoma, you have to use the ABCDEFG of assessing malignant melanoma. First is the A, or asymmetry, diba? Usually it is not symmetrical or asymmetry, okay? And then there is an irregular border. Yan, irregular yung kanyang border. And then the color, okay, especially there is a mixture of black, red, or blue. Yan. And then the diameter, it is more than 6 millimeter in size. Ayan. Then E, it is evolving, or it constantly change, no? The color, the size, and the shape is changing. Yan. And then E for elevation, it is elevated. Yan. Then F, it is firm to palpate. And lastly is the G. It grows progressively over several weeks. Mabilis siyang lumaki. Okay? And then these are some risk factors for melanoma. Could be due to personal or family history of previous melanoma, or atypical or dysplastic moles, okay, also known as dysplastic nevi. They are unusual looking moles that have irregular features under the microscope. Yan. Common din siya or high risk ang mga male gender dahil sila yung mahilig lumabas, mahilig magbilad ng araw, at hindi sila gumagamit ng sunscreen. Okay? 50 or more common moles, yan, high risk na siya na magkaroon nun, or the patient or an individual with red or light hair. Of course, natural hair, hindi colored hair, ha? Okay, continuing with the some risk factors for melanoma. Okay, patient with light eye or light skin color are also high risk for developing melanoma. Or to those patients with actinic keratosis or solar lentigines, it refers to a rough, scaly patch on the skin due to years of sun exposure, especially yung mga farmers natin, no? Okay, those patients who are exposed to ultraviolet radiations from heavy sun exposure, could be sun lumps or tanning booths. Yan. Those who have severe blistering sunburns as a child, they are also at risk. And those who have immunosuppression from HIV or chemotherapy. Okay, to prevent skin cancer, you can include the following in your health education or health teaching for your patient. Recommend your patient to avoid ultraviolet radiation and tanning beds. Remind them that intermittent sun exposure is more harmful. Baka sabihin nila, hindi, bihira lang naman ako magbilad sa araw. The best defense is avoidance. Okay, huwag magbilad sa init ng araw. So, regular use of sunscreen can prevent skin cancer. Recommended use of sun protective factor or SPF 30 and broad spectrum protection. If you are going to swimming pool or beach, okay, water exposure, should use water-resistant sunscreen. Yun pala, no? Dapat water-resistant kapag nag-swimming kayo. Or avoid from HIV or chemotherapy. Okay. So, skin cancer screening. Meron tayong tinatawag na clinician screening. Okay, you have to remain alert during routine assessment. Okay, full body examinations is recommended for patients over 50 years old. Also take advantage of opportunistic screening, meaning there is an available screening for, could be for other reason. Okay, hindi man skin yung i-check dapat, pero isasama na yun sa pag-check, di ba? Katulad na lang sa ating physical examination. Kahit hindi skin yung problem talaga or the chief complaint of the client, kasama yung skin sa chine-check. Okay? Okay, you can also teach your client to do skin self-examination. And to do it, we need the following equipment: a full-length mirror, a handheld mirror, a well-lit room, and the privacy, of course. Okay, so examine the body from front and back, okay, in the mirror, as you can see in the picture. Then right and then left sides with the arms raised. Yan. And then bend the elbows and look carefully at the forearms, the upper arms, the underarms, and the palms. Yan. Look at the back of the legs and the feet, the spaces between the toes and the sole of the feet. Okay, look at the picture again. Examine the back of the neck and the scalp with hand mirror. Part the hair for closer look. Okay, look at the picture again. Check the back and the buttocks with hand mirror. Okay, so again, this is the A, B, C, D, E, and EFGs of examining the moles for possible melanoma. Again, A stands for asymmetry of one side of mole compared to other side. B, irregular borders, especially ragged, notched, or blurred. C, variation or change in color, especially black or blue. D, diameter, it is greater or equal to 6 mm or different from others, especially if changing, itching, or bleeding. E, evolving, a mole or skin lesion that looks different from the rest or is changing in size, in shape, or in color. Okay, suggested adding EFG to help detect aggressive nodular melanomas. Dinagdag yung EFGs. Is it elevated, firm to palpation, growing progressively over several weeks? Okay, that is the end of our topic on physical examination on the integumentary system. I hope you learned something from this presentation. Okay, do not sleep yet. You still have another topic. Okay, we will do physical examination on the head, okay, on the other video. But to end this presentation, let me read to you this verse from Galatians chapter 6, verse 9. Let us not become weary in doing good, for at the proper time, we will reap a harvest if we do not give up. Okay, so ibig sabihin, do not give up. Kahit na hirap na kayo sa online class, you have to pray, you have to work hard for you to become successful. Okay, so have a nice day and God bless to you, my future nurses. Thank you very much. Again, this is the references of my presentation.